Good morning and welcome to Frontiers of Knowledge segment of Dr. Lamba's Awakening Call. Health is wealth is a common adage that we have heard since we were kids. And when pandemics strike, the issue of health, whether it's physical or mental, gains importance much beyond anybody's imagination. And nowadays, vaccines, conspiracy theories about vaccines, rising death toll by the pandemic. But then sometimes we receive excellent news, and that is common remedies which are known to the people since ages and yet are not utilized. Ben Gurion University in Israel has come up with a common food which can help beat coronavirus. A very common food which most of us take every day. At least at one time I used to relish it. The researchers at Ben Gurion University in southern Israel have discovered that probiotic yogurt might be the new super tool in fight against coronavirus. Now everybody knows, at least people in India know it very well, that whenever your stomach used to be upset, you used to be given yogurt, and it was even considered auspicious. You were going for an examination, and your mom would give you a spoonful of homemade yogurt called curd. It used to cool the stomach, they say. But now, these scientists in research and development at Ben Gurion University have identified that the molecules based on probiotic yogurt are extremely useful to combat pathogenic bacteria and for treating various inflammatory conditions, including inflammatory bowel disease and, much more important, COVID 19. Now, what is probiotic yogurt? Is nothing but your homemade curds from which whey has been removed. You put the curds in a muslin cloth, hang it, the whey will come out, and the remaining is your Greek yogurt, add honey to that, and that's it. So Greek yogurt is just your curds placed in muslin cloth, whey drains out after a couple of hours, and you take it. But so promising is this discovery that the university's technology transfer company is itself setting up a startup for further development and commercialization of the technology. And sometimes I wonder that those things which were known to us, our ancestors, really had some meaning. It's only that the science is not discovering something new. It is discovering the reasons only for the utility of that product. Nobody can deny, and it's well known that the probiotics help the body's immune functions. They affect balance, microbial population, and the digestive system, and are potentially protecting the body against bacterial infection. Now, this university says that other better than Greek yogurt, better than the homemade curds, is kefir. Kefir is a fermented probiotic dairy drink, and it's made by inoculating milk with microorganism mixtures, particularly yeast and bacteria. And the scientists have succeeded in isolating molecules in kefir and show that these molecules have significant potential to combat pathogenic bacteria that causes coronavirus. Earlier, they have found And it's confirmed that the camphor secreted molecules are good at fighting cholera. So in a follow-up study, they have isolated this molecule and it has dramatic anti-inflammatory properties in various pathological conditions. Now, what they are going to do is that those molecules they are going to make in the form of either syrup or tablets or capsules and change the structure. The only thing is that they're taking a bowl full of curds, you'll take one tablet or one capsule. That's it. And they say that the disease model in the laboratory has helped heal mice inflicted with lethal cytokinic storm. So it was a lethal disease was created in the mice, and then these molecules were fed, and the mice were okay. And one thing more, they not only eliminated the storm of biotin, but also restored balance to the immune system. And it's an extraordinary feat pointing to significant therapeutic potential. So the old knowledge are the old wine in the new bottles. But it's not only the bottle which is changing, is the extract is being taken, the essence is being taken and you are using it. But if you make it a habit, maybe corona would not hit with the intensity it is hitting. And then comes artificial intelligence, which can help wipe out colon cancer. The discovery by Medtronics has been cleared by FDA, and then they say it will help identify precancerous polyps in the cancer. So when polyps are pre-identified, when they are precancerous and they have been identified, then AI can simply wipe them out. At present, the polyps are very flat and they're hard to see. They do the colonoscopy, sometimes they're found. But according to a Mayo Clinic, the doctors, when they're looking at colonoscopy results, 10 times out of 30, that's almost 30%, they miss those polyps. And when they develop cancers, from pre-cancerous they become cancerous, only then they are identified. But and these colonoscopies are very painful. They are very unpleasant. So now artificial intelligence has been used. My Medtronic and the doctors say that this tool can help improve diagnosis even at a pre-cancer stage when they are not visible, they are just flat on the colon. They can be wiped out on the process of screening itself. And the system is called GI Genius, gastrointestinal genius. And it has seen more colons than the more cancer, the system. Now they are approved by FDA and possibly they will be utilized by the doctors to help you. And this system, they say, can be added to the scopes which are already there when you perform colonoscopy. So this artificial intelligence can be added to that scope. It will follow along the scope as the doctors probe the colon, highlight potential polyps with the green box. And according to them, this is going to remove precancerous polyps by 99.9%. I'm reminded of the advertisements by the antibacterial cleaners. They always say 99.9%. Why not 100%? Why not 99.98%? But whatever. So this is, according to the doctors, much better too. And now, a common thing. We have always been told that the normal body temperature of a human being is 37 degree centigrade. 96.4 degree Fahrenheit. You are less, is below that, sorry, 98.4, yeah. If it's below that, you are weak. If you're above that, you are favored. But it has been seen that the body temperature now has decreased, especially in the high income groups. So the guideline that 37 degrees Celsius is the ideal temperature is no longer valid. As a matter of fact, it's not valid in the low income groups as well because there the pathogen rich environment creates new changes. You see, many of us share the same reflex when we are feeling sick. We measure our body temperature. And indeed, our body raises its internal temperature whenever there's an infection. And this temperature increases to fight those pathogens and those virus and bacteria. The, in the 19th century, a German physician, Karl Wundre, studied the body temperature of the patients and came up with this holy word: 37 degrees Celsius is the ideal body temperature. And now, 2 centuries later, it's no longer true. The recent studies have shown that there is a decrease to 36.5 degree and in many cases to 36 degree. So possible explanation is that the lower number of infection diseases in the past century have led to overall lowering the infection level, lower inflammation, and lower body temperature. This hypothesis, according to the doctors, is valid in high income countries where public health has improved. But in countries in Africa or in any poor country in Asia or here in Latin America, where the infection rate is higher, the body temperature hasn't lowered. So when you are affluent, when you are rich, you are not that strenuous, your body doesn't need that much of heat. So the body temperature lower. But the benchmark now is 36 degrees, going up to 36.5, but not 37. And then comes the news from India. The Indian Institute of Sciences, Bangalore, they have developed artificial enzymes. And these artificial enzymes block reactivation and replication of HIV. Till now, HIV has not been deemed to be a curable disease. But these artificial enzymes made from vanadium nanosheets mimic a natural enzyme and which helps reduce oxidative level in the human body. So cells oxidative stress level is reduced and virus is kept in check and the reactivation of HIV cells is not possible. This has been done by Amit Singh, an associate professor in microbiology in the Indian Institute of Sciences, Bangalore. And they say that at present there is no process to remove HIV from a patient's body. Once the virus is there, it's there forever. And anti-HIV drugs only suppress the virus but do not eradicate it. What happens is that the virus hides inside immune cells in a later state, and whenever it finds time, it becomes toxic. It's like hydrogen peroxide increase in the cells. So this nanotechnology used artificial enzymes take the virus out and just liquidate it. This is a great, great contribution, especially in countries where HIV is epidemic like in Africa. And then before we close today's episode, cannabis is being promoted everywhere, especially in Canada. I see every day my Facebook, my Twitter account is diluted with gummies from cannabis oil, panacea for dizzy pain. But now the doctors have found that there is a close link between cannabis and rebound headaches from migraine. If you take cannabis, your migraine is likely to rebound. Now imagine you take a medicine to treat pain and the pain comes back to you. And this is a study which has been reported in Life Science. And this is a medication overuse headache, MOH. They say if you take cannabis for a long period, then the body becomes resistant to it and your migraine doubles up. It is a rebounding and with a bigger force. So if you have, especially if you have already headache disorder, such as chronic migraine, it will increase. You see, what happens is a formal diagnosis of rebound headaches means that you have overused one or more drugs. And what happens with cannabis is especially not CBD but TCH, that you become habituated to it. And once you become habituated, whether you need it or you don't need it, you take it. I remember CBD was prescribed to me for my pains. And then after 2 months, I said, no, I don't want my brain to be fried. I'll prefer pain than take cannabis oil. And I didn't take it. It's better to live with the pain, relieve it by the natural agents if possible. Ah, adopt your lifestyle to the pain. That's better than taking medication, which is a palliative, never a cure. So these are the few advances that have been made in health sector. I hope they gave you a fresh insight into our issues. We'll meet next week. Thank you.